Hi, I'm Dr. Lauren Natpany. I'm an assistant professor of neurology in the Division of Headache and Pain Medicine at the Mount Sinai Hospital. So stress can definitely affect migraine sufferers. So stress can cause migraine, and migraine can also cause more stress. So it's this snowball effect. And it leads to this just constant and endless cycle of stress, migraine, stress, migraine. And then if your body is accustomed to stress, and this constant daily stress especially, a day without stress, like a weekend or a special event, can result in what we call a letdown migraine. So that's when your stress level drops abruptly, and bam, on your one day off and your one day without stress, you get a bad migraine. We think that stress is linked to migraine because of changes in chemicals and hormones that go on in the body during a stressful event, leading up to a stressful event, or in the letdown phase of a stressful event. And if I say to my patients, I say this all the time, but the migraine brain hates change. Change is like the worst thing for someone with migraine. So you think about all of these hormones and all these chemicals that are abruptly changing in the body, and the migraine brain goes, nope, don't like it, going to trigger a headache. COVID-19 is such a stressful time for everyone, for doctors, for patients, and especially for migraineurs, because it's a time of abrupt change and change that wasn't expected or change that could be prepared for. So I think the first thing that's really important, like I said before, is to recognize how sensitive the migraine brain is to change. And then trying to adapt to that, meaning trying to keep a consistent schedule. I think that's really important, is consistency. With everyone working from home now, or most people working from home, there might not be that same schedule that I go to work at this time, I'm eating lunch at this time, and then I'm done with work at a certain time. For others though, it might be more scheduled, but if that's not you, I definitely recommend keeping a schedule. What that means is going to bed at the same time every night, waking up at the same time every morning, weekends and weekdays, and getting good quality sleep. And I know that it's really hard in life, and especially during stressful times, to get good quality sleep and to get enough sleep, but it's definitely something that should be prioritized. And then during the day, after you get up, have a morning routine, whether it's going out for a walk to get some fresh air, talking on the phone to a loved one, having your cup of coffee or tea, and reading a newspaper, whatever it is, have that morning ritual, and then have it with protein. So have it with something to eat within 30 to 60 minutes of waking up. And then throughout the day, remember, you want to eat healthy, nutritious meals filled with plenty of fruits and vegetables and proteins throughout the day, which means every 3 to 4 hours ideally, but trying not to go long periods without having something to eat, because food helps to stabilize blood sugar levels, and abrupt changes in blood sugar levels can trigger pain. Also, hydration. So we all push hydration. Water is super important, but it really is, especially to migraineurs. So really making sure that you're on a water schedule. What I like to do is I like to have a big glass of water in the morning with breakfast, and I like check that off in my book. Water, first cup is done. And then I make sure to have another one between breakfast and lunch, have another one with lunch, then another one between lunch and dinner, another one with dinner, and then a warm beverage before I go to sleep. And before you know it, you have all of your water requirements for the day. Another thing that can be really helpful is exercise. I know what you're probably thinking. Everybody tells me to exercise. It's a pandemic. I can't go outside. I can't exercise. I just don't have the time or the energy to do it. What I say is, okay, how can we overcome that and find a way to exercise? Exercise really is a great stress reliever. For me, exercise is the only way that really I get out of my own brain. When my heart is pounding faster than my thoughts, it's like this great stress escape. And it can be different forms of exercise. Some people just really like taking a nice leisurely walk. If you can't get outside, there are so many great online apps these days. There are great videos. There are even, you could do it yourself. You don't even necessarily need guidance. But finding a small area of your home, of your apartment, just to do some physical activity, ideally 30 minutes a day, most days, can really help relieve stress, not only in the moment, but also reduce it over time. Next, relaxation techniques such as yoga, meditation, progressive muscle relaxation. All of these have evidence for benefit in migraine. And it might not be, oh, I do yoga in this moment and now I feel better. It's taking on a yoga practice and getting into that mindset at a specific time every day and going through that same ritual, that same practice every day that becomes a routine is really what's beneficial. Same thing with meditation. Meditation is hard. I really look up to those people who sit down and can just meditate. But actually trying to shut down your brain is hard, but is really important. The way I do it and the way I recommend my patients to first start trying to meditate is just saying, I'm going to take a break. So taking a vacation from my brain and from my thoughts. This will mean turning off any electronic devices, walking away from anyone else that's there, and just letting your mind wander. So I recommend to my patients, let it wander to whatever you want, but something that you find beautiful, like a beach, a sunset, remembering a happy time. And then staying in that mental space for a few seconds, a few minutes, whatever your mental break will allow, taking deep breaths and just giving that vacation, that momentary vacation, can be really helpful in alleviating stress. Another thing that you can do is something creative. I took up knitting, some people take up drawing, painting, whatever it is, putting your energy and focusing your energy into something else can make you feel better in the moment, and then completing a project. So making that scarf for your mother or drawing a picture and giving it to your child or your friend feels this great sense of accomplishment, and accomplishment can help ward off stress. I love video visits. I feel like headache is the perfect field for video visits. Why? First, patients with migraine and headache don't really love coming to the office. It's bright, it's loud, there's transportation issues, and being in the comfort of your own home is really helpful. And for me as a doctor, seeing my patients in their own space is beyond helpful, more helpful than I can ever have imagined. For example, I have patients who don't know what medications they're taking or what doses. I have them walk over to their medicine cabinet, they show me the bottle, we review all the doses, and we really can get down into what medications they're taking, what medications they're supposed to be taking, and then I can give them such better advice. Also, patients tell me, I can't do this. For example, I can't exercise. And I say, why not? Well, doctor, I don't have any space. I have them take the camera. We actually go through their space. We carve out a space where they can do exercise. I can guide them on different lifestyle techniques based on their space to help improve their headaches. And then the video is it's just easy. It's relaxing, and you can have family members there who can help give history. It just gives a very nice space to be able to see a patient in their natural day-to-day setting. So I really do recommend video visits for everyone, especially those with headache. Again, most of the time you don't need a physical exam in person with headache. If I see you and if I think there's something that needs to be examined, absolutely, have you come into the office. But just doing that initial video visit, it's fine. Follow-up is really helpful to do follow-up. We can do it frequently over video. And personally, I just hope video is here to stay forever because I love it. I'm super impressed with Mount Sinai and the way that the environment is. So in our building specifically, everyone is screened when they first come in to the lobby. There are separate lines going into the elevator, coming out of the elevator. Everyone's required to wear a mask. If you don't have a mask, one is given to you. When you get up to our floor, there's only a certain number of people allowed on the floor and in the waiting room at a certain time. There's social distancing measures in place. The check-in process can be very, very simple. Don't really have to interact with many people. Again, if you don't have a mask, you'll be given one. Your temperature will be taken, and you'll be placed in a room separately so you don't have to wait with any other patients. And then as doctors, we're all taking the utmost precautions. So we are always in a mask. We make sure every room is wiped down. I personally wipe down all my rooms too. My nurses do it, I do it. We wipe down every surface to make sure that it's perfectly clean for you. And we make sure that there aren't too many people in the office at one time. So that way it's safe, you feel it's safe, and there's much less risk of virus transmission. If you're suffering with headache, even if you do all of the things that I talked about, so you're sleeping well, you're hydrating, you're eating well, and you're managing stress, there's still going to be times when you get headaches, and stress is going to trigger a migraine. Life is just stressful, it is. And that's why it's really important, if you're a migraine sufferer, that you work with a doctor who understands migraine and treats it every day. It's our bread and butter. This is what we do every single day. And as a headache specialist, I really love working with my patients to find the right treatment plan. There's so many different treatments out there, and not every treatment is right for every patient. My goal is to have my patients be able to control their headaches, be able to control their pain, even when everything in their life may seem totally out of control. And especially in a time like a pandemic where who knows what's going to happen. I feel like at least we can work on migraine, on headache, and get that part of life under control. So when life does return back to normal or some sense of normal, headache and migraine is the last thing that my patients need to worry about. So if you're suffering, please come see us. We're happy to help in any way that we can, video, in person. We're here for you. Thank you so much for tuning in today.